Hello everyone. Bonjour, kwe kakana. Welcome to our module on Indigenous-Led Partnerships in Interprofessional Education. If you haven't already, I recommend watching the presentation before this on patient involvement in IPE. A lot of ideas from this presentation, or from that presentation rather, are very transferable to today's discussion when we're talking particularly about involving Indigenous patients in IPE. But there will be, of course, differences in historical, cultural, and political factors. And this isn't going to be an exhaustive video, although I anticipate by my notes it is going to be a long video. But this topic could very easily be its own course. So I really want to focus on some key points and elaborate on some issues that were only brought up really briefly in our reading this week. But ultimately, this is an area where you do need to do your own research because the needs and the preferences of the Indigenous communities in your area may be very different. And a few important notes before we get started. The first is I am a settler ally. So while I am continuously trying to do a lot of learning in this area, like doing lots of readings and workshops, going to community events, talking to knowledge keepers, I myself am not Indigenous. I am not a substitute for listening to Indigenous voices, but I do think that it is important as an ally and as an educator for me to be including these topics in my teaching and integrate these Indigenous issues into mainstream curriculum. And in the interest in understanding my own positionality, like I said, I am a settler ally, but I also have Indigenous in-laws, and I have worked on a res well before I met my husband and his family. So the issues that we're discussing today, like the legacy of the residential schools, health disparities, and even things like language revitalization are things that I've witnessed firsthand as a settler ally, and they're topics that I am very passionate about. My second note before we get started is that some of the topics we're discussing today can be really emotional and painful for people. So if you need to talk to someone, U Ottawa offers free counseling for its students, and there's also Crisis Service Canada that you can contact, especially if you're not a U Ottawa student, which is available in English and French at 1-833-456-4566. And to my Indigenous learners, if I get something wrong, please do tell me. This is an area where I am constantly trying to better educate myself, and I'm always keen to learn more. So before we go any further, I'd like to open up this discussion by giving thanks. And this is an Anishinaabe prayer, which you might recognize from our Welcome to 5105 video back in August, September. And this version was shared with me by Katrina Whiteduck from the Kitigan-Zibi Anishinaabe First Nation, who is one of my in-laws. I'll read the first and last lines in Algonquin, but I'm going to read the rest in English. Apologies for pronunciation errors. Miigwech kaji manido anjaki. Thank you, Creator, for creating the earth. Thank you for every living thing in it. The grass, the fruit-bearing bushes, and the trees, and for all the medicines and the food. Thank you for the animals, ones that crawl, the four-legged creatures, ones that fly, and ones that live in the waters, ones that are medicinal, and ones that are edible. Thank you for the water and everything in it that is so useful. Thank you for giving me air I breathe so I can live a healthy life. Thank you for the fire you gave me for warmth and for light. Thank you for the sky and everything in it, the sun, the moon, and the stars. Thank you for my grandfathers and grandmothers and all of my family. Help me live my life in serenity. Help the sick, bless the dead, the poor, and the ones who suffer from hunger. Thank you for my life. Mi'ai kichi miigwech. That is all, and thank you. And the first time I heard this giving of thanks, it was at a workshop led by Mona Tolley, who is Anishinaabe as well, and she's the lead Indigenous Education Advisor here at U Ottawa. And I'm going to be talking more about some of the things I learned in this workshop as we go through this presentation. And when she shared this prayer with us, she told us to consider how we are all dependent on all these things to live, but they're not dependent on us. And in that regards, we're all equals when we're coming in together and giving thanks like this. And just like how we are also all equals when we're coming together to learn in this course. So what's on the agenda for today? So we're going to start off by talking about land acknowledgements and territory acknowledgements, including U Ottawa's Indigenous affirmation. And then we're going to talk about Indigenous people in Canada, including some information surrounding terminology and colonialism. And then after this, we're really going to delve into Indigenous healthcare in Canada, including talking about the segregated Indian hospitals, health disparities and inequities that we continue to see, and specific cases like Brian Sinclair. And we'll also talk about Indigenous-led partnerships in this section, and some tips for non-Indigenous healthcare professionals. And then we're going to wrap things up by talking about how to request services from knowledge keepers and protocols surrounding doing so. And at the end, I'll also share some additional resources for learning more. And I'm aware that for some people this will be review, and for other people this will be entirely new. So as always, I have the timestamps down below in the video description, so you can kind of jump around the video as needed. And for my current learners, the slides are also available on Brightspace if you prefer to consume this information that way. So whose land are you on? Let's start things off by talking about land or territory acknowledgements and UOttawa's Indigenous affirmation. So land acknowledgements are very common nowadays, and you'll see them a lot around the university, for example, on websites, in conferences, things like that. And you may have even done land acknowledgements yourself in your own teaching. And these statements are meant to be a way to acknowledge the original First Nations, Métis, and Inuit inhabitants of this land. And formal land acknowledgements that we now see in universities, for example, actually started back in the 1990s in Australia as part of their own reconciliation efforts. And originally, institutional land acknowledgements like this were meant to be educational and relationship building, reminding settlers of the long-standing Indigenous presence within the lands that they were occupying, and also challenging the myth that settlers found these lands just completely uninhabited, because that's just not true. However, as land acknowledgements are being delivered more and more, particularly by non-Indigenous people like myself, many criticisms have arisen. For example, them being superficial and performative rather than being meaningful. For example, they can be used performatively by settlers, so it seems like they're aware and sensitive to issues when in reality they haven't actually made any changes in their practice. And for example, Hayden King, who is Anishinaabe, helped write the land acknowledgement at Toronto Metropolitan University, and he has since publicly said that he regrets doing so. And one of the issues that he has is how it's being used so superficially because it's a scripted land acknowledgement. And these scripted land acknowledgements don't encourage non-Indigenous people to do the work to look into whose land they're on and what that means for them. In a similar vein, land acknowledgements can be purely symbolic gestures with no commitment to change or action. And scripted land acknowledgements in particular get treated like a tick box that just needs to be checked off at the beginning of an agenda or beginning of an event before you get down to the real business of the meeting or the event. And there are certainly more controversies and potential issues here. These are just some of the major ones that you'll hear about quite a bit. I recommend reading the article by Work 2021, which will be in my reference list at the end, which gives a much more in-depth exploration of these issues. He also talks more about how land acknowledgements and apologies can construct a false image of benevolence on a national level, or the benevolent peacekeeper myth in Paulette Reagan's Unsettling the Settler Within book. And it can make it seem like colonialism is done, even though it's still ongoing. So on the slide here, you can see UOttawa's Indigenous affirmation. I'm going to read it in English, but I'll also post the link below where you can hear it spoken in Algonquin. We pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So the University of Ottawa itself, on the campus, is situated on unceded, unsurrendered Algonquin land. Many of you also join us from Algonquin territory. For example, Angus, who teaches the other section, actually physically teaches at UOttawa, and then he also lives in Algonquin territory. But the issue we run into with this affirmation, at least in my opinion, is that it's once again kind of a copy and paste job. At the beginning of the semester, we were sent a syllabus to use as our outline, and this is what they wanted all the faculty to put at the beginning of their syllabus. And in my opinion, and I'm sure in the opinion of others, this runs into the risk of this Indigenous affirmation being used as a tick box activity. And as I've mentioned in our class, it doesn't represent everybody who attends classes at UOttawa or who works at UOttawa, especially in our HPE program since we're an online program. I know some of you right now are out in British Columbia. I have some learners in the Maritimes, for example. In the past, I've had learners from as far away as Australia and China. And I personally don't live in Algonquin territory, so it would be disingenuous and superficial for me to use this Indigenous affirmation word for word in my syllabus. So those of you in my section will notice that the Indigenous affirmation in my syllabus looks a little bit different. I was pretty conservative on my efforts because I wasn't sure how the university would react, but I'll probably be a little bit more bold next time I'm teaching. I still wanted to acknowledge the Algonquin people because that is where UOttawa is situated, and that's also where the majority of my students live and work. But I teach on the lands of the Haudenosaunee, Wendake-Nia-Wenseo, and the Kanien'kehá:ka nations. I also want to add my own thanks to those who not only share this land with me, but those who also share their teachings with me. I'm really grateful to those who take the time to teach me and answer all of my questions because they certainly don't need to do so. And at the end, I added also in a line about learning whose land you are on. And so let's talk a little bit more about that. So as educators, it's important for us to know where our feet are planted. And this is something that Gilbert White Duck from the Kitigan, Zibi, and Anishinaabe First Nation talks about in our Motivation Monday video this week. So do you know whose territory you live on? And I encourage you to check out Native Land Digital's website, which is an Indigenous-led not-for-profit organization. And on their website, they have a tool that maps out Indigenous territories, treaties, and languages. And while it did initially begin in North America, it has spread increasingly worldwide, and they're regularly adding new places. And it's certainly not a perfect tool, but it is a really good starting place. And for those of you who are in BC, you'll notice that not much pops up when you have just the treaties filter on. And this is because BC is very much built on unceded lands, which means the land wasn't surrendered through treaties. Facilitators for MLC work this week, you are more than welcome to incorporate this activity into your role this week. And I have a few questions for you to answer on your own as well. The first two are from the workshop I did with Mona Toli, and I have a few more questions from her later in the presentation. And then the final one is from Native Land Digital, and I thought these were excellent questions. So I invite you to consider the following. Who are the Indigenous nations where you grew up? Who are the First Nations, Métis, and Inuit of the territory in which you work? What do you know about them and how come? And what are you or your organization doing beyond simply acknowledging the territory where you live, work, or hold your events? And the Native Land Digital website also shares some really great tips for learning how to say a nation's name if you're unsure. The first tip is ask someone. For example, you can ask someone from the nation or someone at a local organization. For example, Ottawa's Indigenous Resource Centre could be a good starting place. You can check their website. On their website, they may have a recording of someone saying the nation's name, or they may explain how to pronounce it. And you can also call the band after hours. Their answering machine will likely say the nation's name on it. And another option I'll add in here is YouTube, because as a millennial, I love YouTube. There might be a video online on YouTube somewhere of someone saying their nation's name. And when doing land acknowledgements in your own teaching, I encourage you to really be mindful of how you're engaging in the acknowledgement. You are a role model to your learners, even when your learners are adults. And you don't want to fall into the trap of a land acknowledgement just being a box you have to check off. This really should be something you're meaningfully engaging with, otherwise it just becomes performative. So you want to engage in this as an act of allyship. And like Gilbert White Duck discusses in the video I shared with you, acknowledging whose land we're on doesn't have to constantly be this big event. It can be more an act of reflection and gratitude that we do regularly in our own minds and in our own hearts. And in one of the workshops I did with Mona Toli, she discussed how she would rather see someone say they're uncomfortable and they're still kind of trying to figure this all out, rather than taking the checkbox approach. And she pointed out that, we're kind of in this awkward, tense place because we're in the midst of trying to navigate reconciliation and a relationship that's gone bad. And so in our next section here, we're going to discuss Indigenous people in Canada. And there's been a lot of evolution in the terminology that we use here, which you'll probably see as you're reading different articles or talking to different people. The Office of Indigenous Initiatives at Queen's University has a really great terminology guide, which will be included in my reference list, and I recommend checking it out if you're unfamiliar with any of these terms. So Indigenous is an umbrella term that refers to all First Nations, Métis, and Inuit groups, and for many people this is now the preferred term. And it's really important to note that these groups aren't homogenous groups. They are comprised of many different sovereign nations and clans. And until fairly recently, Aboriginal was the preferred term, but it does have some negative baggage surrounding it. In Canada, when the term Aboriginal is used, it refers to First Nations, Métis, and Inuit people specifically in Canada. So it's not as broad as Indigenous, and it's not used as much internationally. Some other terms you should avoid are Native and Indian. There are some exceptions though. One exception being that if someone with Indigenous ancestry identifies as Native, and some organizations in particular, if they've been around for a while, might have Native in the name, like Native Land Digital. Indian isn't a term we use anymore and has a lot of really negative connotations. You will still see it though in legal and policy contexts, for example, the Indian Act or with terms like status Indian. And I also want to add here that you might also see it in a lot of historical contexts. So like when discussing the Indian residential schools or the segregated Indian hospitals, because that's what they were called. And the Queen's University Terminology Guide makes a few important notes about these terms in general. So first of all is that these are adjectives, they're not nouns. So we wouldn't say that a student is First Nation, we'd say that they're a First Nation student. And second is that Indigenous people don't belong to Canada. they're part of their own sovereign nations. So we wouldn't say Canada's Indigenous people or Canada's Aboriginal people. You also want to say something like our Indigenous people, because that's quite paternalistic. So the guide suggests saying things like the Indigenous people of Canada if you need to be more specific. And when referring to an individual person, you should use the actual nation's name when you're referring to them. For example, I would say Mona is Anishinaabe rather than Mona is Indigenous or Mona is First Nations. And a good tip from Mona Toley is just to call people what they want to be called. And if you're ever not sure of the most appropriate term to use to refer to someone, just ask them what they want to be called. So the 2021 census reports that there's 1.8 million Indigenous people in Canada, which is approximately 5% of our population. And about 3/4 of them live in large urban population centers. And about 40% of First Nations people with registered or treaty status live on reserves. This population overall is younger than non-Indigenous population in Canada. Their average age is about 33.6 years compared to 41.8 for non-Indigenous people in Canada. And about 1/4 of their population is 14 years of age or younger, compared to about 16% among the non-Indigenous population in Canada. And over 70 Indigenous languages are spoken in Canada. Some are being revitalized, but most are in decline. So let's talk a little bit about colonization. So our reading this week by Allen et al. 2020 talks about some of the colonial policies that have been inflicted on Indigenous people in Canada. For example, the residential schools and the 60s scoop. And these sorts of policies can be connected with high rates of addictions and substance abuses in Indigenous populations. And I have another video where I talk about colonization in the residential schools in much more depth, as well as the legacy of the residential schools that I witnessed while working as a nurse on a res. I recommend checking out if this is a newer topic for you. But the Coles Notes version here of at least this issue is that the settlers in Canada wanted access to the land, and they used a variety of different strategies to gain control of the land, like treaties, waging wars of extinction, disrupting families, and imposing European beliefs and values as universal values that everybody needed to follow. And the treaties between Indigenous nations in Canada left the Canadian government with commitments that it didn't want to fulfill. So they embarked on a cultural genocide campaign. For example, banning spiritual practices, relocating Indigenous people to remote reserves, disempowering band councils, and imposing policies like the residential schools and the 60 scoops. And I talk a lot more about these sorts of issues in my other video, so I'll link it down below. But what's important to our discussion today is that this also included suppressing knowledge of Indigenous healing methods and radically disrupting their being passed between generations. And something that isn't mentioned in our reading this week, but I think is really important to talk about when we're talking about healthcare here, is the segregated Indian hospitals, which I'm going to talk about further in our next section. And there are many consequences of colonization on Indigenous people in Canada, things like poverty, racism, stereotypes, intergenerational trauma, addictions, substance abuse, mental health issues, and a number of health inequities, which we're going to discuss in a moment. To learn more on this, I highly recommend checking out the Truth and Reconciliation Commission's final report. In this, they interviewed over 6,000 witnesses and analyzed documents related to the residential schools as part of their investigation. And this is just the summary book for it. The whole report is huge. It includes 10 books, including this one has the first book in it. I do recommend checking out at least this summary. They also published an interim report called They Came for the Children. And all of these books are available free online for anybody to read. You don't need to access them through an institutional library. And they are also available for purchase if you want a hard copy. And there are 7 calls to action related to healthcare in the TRC report. So call to action 22, which is also mentioned in Allen et al. 2020 reading we did this week, is probably the one that's most relevant to our course. So in it, the TRC says, "We call upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients." Furthermore, the TRC report asserts that best practices for Aboriginal wellness involve a range of services from mainstream healthcare to traditional practices and medicine, all under community leadership and control. And I have a final question for you to reflect on before we move into Indigenous healthcare in Canada. And this is my final question written by Mona Toley that I want you to consider. And she asks, what has the treatment of Indigenous people/nations allowed Canada and you to benefit from? So next up, we're finally getting into Indigenous healthcare in Canada. And as a heads up, in this section, we are going to be talking quite a bit about abuse, racism, and deaths within the healthcare in this section. So let's jump back to the segregated Indian hospitals, which I had mentioned earlier. So I hadn't heard of the segregated Indian hospitals until I started doing my PhD. And while I know that Indigenous people in Canada have historically been mistreated by the healthcare system, and they continue to be mistreated, this isn't something specifically I'd heard about until I started educating myself on these issues. And historically, the impetus to address Indigenous healthcare came about when the Canadian population and government realized that Indigenous people, who previously were thought of to be a dying race, weren't dying out. Instead, they were increasingly having more and more contact with non-Indigenous populations, which was seen as problematic at the time due to high tuberculosis rates amongst many Indigenous groups. And TB has long disproportionately impacted Indigenous communities in Canada. For example, in 1934, First Nations comprised only 1.6% of Saskatchewan's population, and yet they accounted for 27% of all TB deaths in the province. And this wasn't an issue limited to just Saskatchewan. If you look through the literature, you can find equally appalling rates in BC and Manitoba, for example. So the opinion was that they needed to be treated, or preferably isolated, to protect the general population, i.e. the white population. So the hospitals went to great lengths to separate Indigenous patients from white patients. For example, the hospital in Yellowknife had a separate entrance and waiting area for the Indigenous ward. Others, like St. Boniface Sanatorium in Manitoba, had entirely separate buildings for Indigenous people. And I want to make it clear that this segregation wasn't limited to just Indigenous people. People from other races were segregated too. For the purposes of our presentation today, we're just talking about Indigenous healthcare, but I do encourage you to look further into this. And the decision to progress or devolve, perhaps more fittingly, to entirely segregated hospitals was due to a number of factors, including 1, the public outcry about being exposed to Indigenous people with TB. 2, scrutiny from tuberculosis associations that the Department of Indian Affairs was ignoring tuberculosis amongst this group. And then 3, some hospitals were refusing to admit Indigenous patients. But we can summarize this all up in one word, was racism. This resulted in 22 racially segregated Indian hospitals being built in Canada, potentially more if you include the medical facilities at some of the residential schools like St. Michael's Indian Residential School in British Columbia. Only 2 were specifically built to serve as segregated hospitals. The rest were repurposed buildings, for example, renovated residential schools or military barracks. The majority of these facilities were in Western Canada, but there were also 3 in Ontario and 1 very briefly in Quebec. And 2 of these hospitals in Alberta were actually band-owned, and they did incorporate traditional healing practices with Western medicine. In some cases, these hospitals did give remote communities access to medical care, but some patients have also described their experiences of being rife with abuse and neglect. And Gary Geddes' Medicine Unbundled provides a very descriptive account of the abuse and neglect and malpractice that many Indigenous people experienced while they or their family members were in these hospitals. For example, being bullied, locked in closets, and being physically and sexually assaulted by staff. And that's not to say that all healthcare workers were abusive or neglectful. Some healthcare workers are described as providing excellent quality of care or even dying from diseases that they contracted themselves while serving in Indigenous communities. However, this doesn't undo the racism underlying these hospitals, nor the prevailing belief that Indigenous people were inferior to European Canadians. And in Medicine Unbundled, the author also talks about the fear that Indigenous people may still experience surrounding hospitals and healthcare professionals, and how that stems from this abuse and racism that they have suffered. And so now you may be thinking, okay, thank goodness we have progressed from that, but unfortunately we still have a lot of work to do. Indigenous people in Canada face a number of health inequities compared to the Canadian population overall. For example, decreased access to care. For example, Indigenous communities in rural areas may experience greater difficulty in accessing a regular primary care provider. Remote communities in particular may rely on health centers that are staffed entirely by nurses and community health workers. And there can also be geographical barriers to accessing specialized services. Statistics Canada found in 2021 that approximately 19% of First Nations people living off reserve reported not having a regular healthcare provider, compared to 14% of Canadians overall. And an important legal rule surrounding access to care for First Nations children in Canada is Jordan's Principle, which is supposed to ensure that First Nations children in Canada have timely access to the services, products, and supports that they need. For example, mental health services and medical equipment. And this also includes things like educational supports. And it's named in memory of Jordan River Anderson from Norway House Cree Nation in Manitoba. Jordan was born in 1999 with multiple disabilities, and when he was 2, he was finally cleared to be discharged, but he was going to require home care to ensure that all of his needs were met. But Jordan never got to go home because the provincial and federal government couldn't come to agreement on who was going to pay for this care, and he passed away at the age of 5, having never gotten to leave the hospital. So Jordan's principle came into effect in 2007, and it ensures First Nations children receive the services, products, and supports that they need, and that the payment will just be figured out later. Jordan's principle is now a legal obligation, so while different programs may phase in and out over time, there is no end to Jordan's principle in Canada. However, First Nations people were having a very difficult time getting the assistance that they were entitled to through Jordan's principle, and ultimately it went before the Human Rights Tribunal in 2016, and the Government of Canada was found to be discriminatory in its approach to services for First Nations children. And a few follow-up orders have also been made since this initial ruling. And there's actually a really great CBC Kids video that does a really nice explaining of Jordan's principle and who Jordan was and the issues that have arisen since then, so I'll link it down below for you. And despite the Canadian Human Rights Tribunal's ruling, there continues to be issues in accessing services through Jordan's principle. And I'll link a recent news story on this down below as well. A further health inequity faced by Indigenous people in Canada is greater disease burden and poorer health outcomes. For example, higher rates of diabetes, tuberculosis, and cancer. Rates of mental illness are also high, as well as those for substance abuse and addiction. Also, higher rates of premature mortality due to things like injury and suicide. And Indigenous people in Canada have a lower life expectancy than the rest of the population. And very much interrelated with health is issues surrounding food and water. So Indigenous people in Canada also face higher rates of food insecurity, and they are also disproportionately impacted by water insecurity, water advisories, and they experience more waterborne diseases than non-Indigenous people in Canada. Indigenous people in Canada can also face racism, stereotypes, and prejudices. And colonization and intergenerational trauma from things like the 60s scoop and the residential schools have left Indigenous communities with physical and mental trauma, which can contribute to self-destructive actions like substance abuse. And the way that this is portrayed can lead to stereotypes that can negatively impact Indigenous healthcare, like assumptions that all Indigenous people are substance abusers, or that they're faking being unwell just to get medications, and this means they may not be taken seriously. For example, in 2008, Brian Sinclair, a 45-year-old Anishinaabe man, was sent to a Winnipeg emergency room to have a catheter changed due to blockage at the recommendation of the Community Health Center. He presented to the emergency room with a note from the clinic explaining his condition. He was never triaged and he was just sent to the waiting room. He died of sepsis after sitting in a wheelchair for 34 hours without being seen because staff assumed he was homeless or he was intoxicated. He was deceased for about 2 to 7 hours before anyone even noticed. And Joyce Echaquan is a more recent case in the news. She was a 37-year-old Atikamekw mother of 7 who died in a Quebec hospital. She had filmed herself from her hospital bed, clearly in pain and pleading with staff for assistance shortly before her death. Near the end of her live stream, 2 staff came into her room and started making degrading comments, calling her stupid, accosting her for making bad choices in her life, and telling her she'd be better off dead. Staff had assumed she was a drug abuser and she was going through withdrawal, despite there being no evidence of this whatsoever, and they ignored her pleas for help. She ultimately died from pulmonary edema due to a pre-existing heart condition, and the coroner found that racism and prejudice had contributed to her death. And these 2 cases are, of course, not the only examples of the sort of prejudice and racism impacting the care of Indigenous people, but they certainly are very important and very publicized cases. There can also be distrust in healthcare professionals, the healthcare system, and the government. Previous negative experiences, for example, may delay Indigenous people in seeking care, and it may make them distrust healthcare professionals. They may also not trust healthcare that is being provided by government agencies, given the colonial history. And they may also feel fearful or intimidated when they're talking to healthcare professionals, and this could stop them from asking questions of their provider. And I want to share this quote with you from Dr. Barry Lavallee, who is a professor at the University of Manitoba. Medicine and health always sees itself as benevolent and caring for people. It's not true for many Indigenous people. It's a violent encounter. So let's talk about Indigenous-led approaches to healthcare. So Indigenous-led partnerships are interprofessional collaborations that are grounded in Indigenous knowledge, which is maintained and upheld by elders and knowledge keepers rather than Western knowledge and structures. And a biomedical perspective is integrated as needed and wanted. And these partnerships can take place in a variety of different settings. It could be at an urban hospital, where I think the majority of you work, and they can also take place at remote clinics and in community-based healing lodges. And our reading talks about how there's evidence that Indigenous people do want more access to this sort of traditional healing and Indigenous-led health services. And our article also mentions that at least physicians are interested in interprofessional partnerships with Indigenous communities, which is great. And a narrative review looking at access to care in Indigenous communities in Canada also suggests that including Indigenous people, such as elders, in interprofessional teams can ensure culturally appropriate care, and it can be a strategy to help avoid negative stereotyping of Indigenous patients. And Indigenous healing practices are being revitalized in many Indigenous groups. And Indigenous worldviews surrounding health and healing are much more holistic, unlike Western medicine, which is much more focused on disease in the biomedical model. And Indigenous perspectives on health may contend that the social and emotional and cultural and spiritual aspects of the individual's health also need to be addressed within the healthcare system, whereas Western perspectives tend to treat these other elements of health and well-being as something that should be handled outside of mainstream healthcare systems. And this can involve a variety of different people with expertise in Indigenous worldviews and healing. So some terms that we use in English for this are knowledge keeper, elders, ceremonialists, herbalists, spiritualists, and traditional healers. Different cultures may have different types of roles related to healing and their own words for these. And partnering with these individuals can aid in the provision of more culturally appropriate care, as well as addressing the health inequities and traumas that many Indigenous communities have experienced. And Indigenous healing practices can include a number of different ceremonies and remedies that promote holistic well-being, including spiritual, mental, physical, and psychological. So some examples of Indigenous healing practices can include things like on-the-land healing camps, smudging, sweat lodges, cedar baths, and spiritual ceremonies, which can vary between nations. And something that I've recently learned through my in-laws is the role of dancing in healing. And the Indigenous Resource Center's protocol guide, which we're going to talk about in our next section, also talks about how dancers might dance at powwows for their own healing. They may also dance for the healing of a family member or for the community. And our reading for this week lists off a number of examples of Indigenous-led partnerships in Canada. A further example I found in the literature is also the Aboriginal Diabetes Wellness Program that's offered by Alberta Health Services, which was created in consultation with Indigenous healers. And this program incorporates Indigenous traditional healing into mainstream healthcare services offered by Alberta Health Services. Now, I've mentioned elders and knowledge keepers a couple of times, and so has our reading, and some of you may not be familiar with what this means. So it's important to note when we're talking about issues like elders and knowledge keepers that some of the terms that we use here in English are disputed amongst different groups because these aren't the traditional terms. For example, some of the terms we might use in English are elder, knowledge keeper, traditional knowledge keeper. The Indigenous Resource Centre here at Ottawa suggests using the term knowledge keeper if you're unsure of someone's title, but ultimately to use whatever the person's preferred term is. And there are many different types of knowledge keepers. For example, a first language speaker would be considered a knowledge keeper, as would an elder. And knowledge keepers carry a knowledge that has been passed down for innumerable generations, and they walk in a good way. And some other examples of knowledge keepers includes drummers, fiddlers, singers, dancers, and artists. And it's important to note that elders is a specific title and a role that is given to a person. Just because someone is in an Indigenous community, is older and they are well respected, doesn't necessarily mean they are an elder. This is something that is appointed by their community. And there's no age requirement to being an elder, and they don't need to be an elderly person, as the English term kind of implies. All knowledge keepers deserve great respect. They also deserve fair compensation for their work. For example, offering them an honorarium if you're working with them. So the rate will depend on the individual, and we and the university don't get to dictate this amount. Ottawa says to expect a minimum of about $250 an hour. And the university does have funds for this sort of thing, and the protocol guide that I'll discuss in a moment talks about this a little bit more. We can also offer gifts like tobacco ties to show our appreciation, which we're also going to discuss in a moment. And the article we read this week by Allen et al. 2020 has a list of some recommendations for healthcare providers, managers, and researchers for supporting Indigenous-led partnerships in Table 3. I'm going to focus on a few that I think are good starting points. So commit to critical self-reflection and continuing professional development. For example, reflecting on your practice and biases. Take some time to learn about cultural safety, the TRC report, and its calls to action. Learn about Indigenous history and practices. And if you're an educator, consider these topics in some of the ongoing education that is offered in your workplace and in your own courses. And keep an eye out for CPD opportunities for yourself in this area. If you see anything offered at UOttawa, particularly with Mona Tolley, I highly recommend you sign up. She's a fabulous educator. Be genuinely curious and respectful. Be open to patient disclosures of traditional medicine use or consultations with healers and elders. Be genuinely curious about their experiences, preferences, and beliefs. Don't make this a substitute, though, for doing your own professional development on these issues, because you are responsible for your own CPD. Consult with elders and traditional knowledge keepers. For example, having elders on advisory committees at hospitals or in clinics, or having them as part of your research team if you're doing research. This could also be having a traditional knowledge keeper providing cultural education for staff. You can also integrate Indigenous voices into your teaching through guest lectures, assigning readings or videos by Indigenous people, and get involved with ceremonies and community events. Gilbert White Duck also encouraged us to do this in the video we watched. So go to powwows, talk to people. In Ottawa, for example, there's the big Summer Solstice Indigenous Festival, which is a big competition powwow. In the past, Matahokie Farm in Ottawa has also done a smaller winter Pibon festival, although I haven't seen anything about it yet for this year. You can also check out local bands and nations, and the Canadian Museum of History and UOttawa also sometimes host events. And related to this, I'll share with you 2 pieces of advice that my father-in-law gave me. One is listen to the MC's instructions. They'll usually fill you in on instructions regarding photography, who is allowed to dance at certain times, etc. And 2, what the dancers wear is called regalia, not a costume. Also, do not touch the regalia, and if anything falls off of it like a feather, don't pick it up, just leave it on the ground. Ensure a welcoming environment and safe spaces. For example, having Indigenous artwork and plaques to help indicate that they are welcome. And set up safe places for Indigenous patients and family and staff. For example, having smudge-friendly spaces for them. And try to greet people in their traditional language at the start of appointments. So here's a few very basic Algonquin words for those of you who are practicing in unceded Algonquin territory, like Ottawa. So kwe is hello, Niawen is goodbye, and Miigwech is thank you. And please note that there are different ways to spell these because they come from an oral language, so you might see different spellings for these in different places. A couple of other tips I've received from people. In one of the workshops I did with Mona Tolley, she suggested introducing herself not just in terms of your academic credentials, and instead considering who are you and who are you in relation to others. So for example, in her workshop for the introduction, she talked about her various roles and responsibilities, and it was a much more holistic, comprehensive introduction to who she is as a person. So now in my own introductions, I focus less on my academic credentials, and I talk more about who I am, including introducing myself to the class as a wife and an aunt, for example, and that's something I've changed in my practice. The next piece of advice, which I also got from Mona, surrounds Orange Shirt Day in Canada. So if Orange Shirt Day is on a weekday, don't schedule any assignments or quizzes for that day. Also, don't give Indigenous learners a hard time if they're absent that day. It is a very emotional time. And I've found in my own teaching that this is appreciated. I've had Indigenous learners who are often quite busy that time of year. They may have their own speaking engagements, or they may have family or community members that they need to support during this time. And it can be a really physically and emotionally draining time for them. And there can also be other important days and powwows and things like that, so just be mindful. And related to this also is checking in with Indigenous learners when you know things are going on in their community or on a larger scale. So Mona Tolley gave the example of when the unmarked graves were found next to the residential schools, which was a very traumatic time for many Indigenous people. And finally, allowing for different ways of expressing knowledge and knowing. This is something Mona talked about in her workshop, and I've also had conversations with Gilbert White Duck about this. So for example, in my own teaching, I allow for assignments to be completed in a variety of different formats, including orally through video presentations. Sometimes there is a need for something to be in writing, something that Gilbert and I have also talked about. But generally a more flexible approach like this works given the nature of the courses that I teach, at least, and my own learning objectives. And I find that this is also an approach that benefits learners with a variety of different learning exceptionalities. As some people might be worried about making mistakes on this journey, and here I want to include a clip from Gilbert Whiteduck speaking to this concern here, because I think what he has to say on this topic is really important, and it's best when it comes from his mouth, not mine. But I highly recommend watching this whole video if you haven't already.
People believe that sometimes that while they're walking, they've made an error, they've made a mistake, or I shouldn't have done that. My belief is that no one makes a mistake. Unless you're doing it with purpose to hurt someone, that's different. But when you're doing it for the right reasons, those things that happen are learning opportunities that you need to extract from to help you grow. Never to hold back, never not do anything because we're afraid to do something. We do it, and when we do it, when it comes from our heart, it can only come from a good place, and the outcome of somebody saying, hey, that's wrong, shouldn't worry, because something has been learned from it.
And I think talking about requesting services, including having someone come talk to your class or offering guidance, might be a good way to wrap things up. So specifically here, we're going to talk about protocols and tobacco very briefly. So protocols are a pre-described way of doing something, which sets up positionality in relationships. We're going to talk about tobacco offerings specifically here, but protocols can also include things like opening prayers at gatherings, gifting, feasts, etc. When requesting the services of elders and knowledge keepers, there are protocols that are followed, and we follow the same protocol for both groups. And these protocols can vary. For example, they can differ depending on the nation or clan. And today we're going to talk about the protocol guide that was put up by U Ottawa's Indigenous Resource Centre. As part of the protocol, we offer gifts like tobacco ties, which we'll discuss in a moment, to show our appreciation. This is independent of a payment or honorarium. In our Motivation Monday video, Gilbert Whiteduck also reminds us that tobacco is not a payment. Knowledge keepers deserve fair compensation for their work, and this sort of gifting is about showing our appreciation, not paying them. So traditional tobacco, it's called Nasema in the Algonquin language, and it's commonly given to First Nations and Métis communities when we are asking an elder for advice or for guidance. Inuit elders don't expect tobacco, so you can offer them some sort of other small gift. And U Ottawa's protocol guide has some examples of gifts that you can give, as well as gifts that would be appropriate for other Indigenous groups in the Ottawa region. In the past, I've given things that I've baked because giving things you had baked or cooked was acceptable as part of that nation's protocol. I've also given beaded jewelry, and I've given tobacco too. I've also given tobacco for other things. For example, I've given it to one of my sisters-in-law for her dancing at a powwow, which was then put in her purse where she carries her medicines. And the Indigenous Resource Centre explains that tobacco sits in the east position of the medicine wheel, with the east symbolizing the first stages of life in infancy, as well as beginnings in springtime. And I have an example of an Ojibwe medicine wheel here on the left. The medicine wheel might look a little bit different depending on the nation and their own stories and beliefs. I'm not going to talk about the medicine wheel too much here because I do not think I'm the right person to be teaching this. I'll link below an interesting article, though, on the medicine wheel and its use in Indigenous education. That was written by Dr. Nicole Bell, who is from Kitigan-Zibi First Nation and is a professor of education at Trent University. So this is what traditional tobacco looks like. When I bought it, it came in a huge pack, and it was much more than I could ever get through with just tobacco ties. So I took a portion for myself for this sort of thing, and I gave the rest to a knowledge keeper to distribute to their community. And then this is an example of a tobacco tie, which we'll talk about more in a moment. I made this one to burn in a sacred fire, but I got distracted at the last powwow I was at, and I forgot to burn it, so I'm saving it for my next sacred fire. So let's talk about tobacco ties. So when we present someone with tobacco, we present it in a tobacco tie, which is a pinch of tobacco like this, wrapped in a small square cloth, and we offer it even if the knowledge keeper has been financially compensated, because, as I said, this is our way of showing gratitude. The Indigenous Resource Centre recommends beaded dreams in downtown Ottawa for getting traditional tobacco, which is also where I got mine from. And I recommend purchasing it really well in advance because sometimes it's sold out. I had a really hard time getting some last year because I needed it right before Orange Shirt Day, so do plan ahead. And the Indigenous Resource Centre says you can use smoking tobacco if you can't get traditional tobacco, but traditional Nasema is preferred. And U Ottawa's Indigenous Protocol Guide has instructions for making a tobacco tie. I struggled a little bit with their technique. I found a really good video by Bear Standing Tall Digital Awareness, and he shows how he makes his tobacco ties, and I found his technique to be a lot easier for me. It's a really short video, and I highly recommend checking it out. I'll link it down below, and I'm probably up in the cards, I guess. The only difference is that I use a cotton string to tie mine off instead of just tearing a strip of the fabric. And when you're making them, the cloth size that was recommended in the protocol guide is about 10 centimeters by 10 centimeters. And your intentions go into the tobacco tie as you're making it. So as you're making your tobacco tie, you want to be thinking thoughts of positivity and gratitude while you're making it. And the tobacco should not be handled if you've recently consumed drugs or alcohol, because it is a sacred medicine. When presenting the tobacco as part of a request, the Indigenous Resource Centre makes the following recommendation. So they recommend emailing the knowledge keeper first to set up an initial meeting, and then you can make your request in person. And you want to bring your tobacco tie to this first meeting. The U Ottawa's protocol guide says to place the tobacco tie on a table or indicate that you're presenting to it. Others say to present your tobacco tie in your left hand with your palm up. And they say to use your left hand because your left hand is closest to your heart. And then you make your request. And you shouldn't invite them just to do an opening prayer. You should be inviting them to participate in the entirety of the event. If they accept your request, they'll accept your tobacco. And in our Motivation Monday video, Gilbert White Duck also assures us that refusing your tobacco doesn't mean that they're mad at you or you've upset them. It just might mean it's not the right time for your request. And then you should provide them with written details surrounding your request and find out if there's anything else they may need from you, such as money for a taxi, parking, things like that. And then when they're at your event, make sure you're treating them well. And the Indigenous Resource Centre makes the following recommendations. So meet with them when they arrive to walk them from their location and ensure their parking and taxi and everything is all covered. Offer tea or coffee upon their arrival, and a meal should also be offered if they're going to be there for more than 3 hours. Do not touch anything they have brought unless they've given you permission to touch it. And no photos or recordings unless they have said okay, and make sure you ask about this in advance. And some ceremonies like smudging are not to be photographed. So throughout this video, I have made some recommendations for websites and videos to check out, such as surrounding making tobacco ties. A few other additional resources I just wanted to highlight before we wrap things up. So U Ottawa's library has a list of titles that they've put together for National Day for Truth and Reconciliation, which I recommend checking out. I also really recommend checking out the TRC's summary report. It covers the history of the residential schools, ongoing legacy, calls to action, available free online to the public. The Legacy of Hope Foundation is a website that I also recommend checking out, and it allows you to hear the stories of residential school survivors in their own words, and I'll link to that below. I also highly recommend checking out Medicine Unbundled, a journey through the minefields of Indigenous healthcare, which covers the segregated Indian hospitals. It's also a really good reflexive piece of work about working with Indigenous people, as the author is not Indigenous himself. He also reflects on his family's own complicity in colonialism, like the 60s Scoop, and I learned a lot from reading his novel. This book is available free online for U Ottawa students through the U Ottawa Library. I also have a couple of books on my personal reading list that just arrived yesterday. So Structures of Indifference, An Indigenous Life and Death in a Canadian City. So this one is about Brian Sinclair, the gentleman who died in a Winnipeg emergency room. And then another one on my list to read is Fighting for a Hand to Hold, Confronting Medical Colonialism Against Indigenous Children in Canada, which was recommended to me by a former student. So I'm really excited to get into these. And I also have a couple of recommendations from other profs here at U Ottawa. I haven't read these ones but I want to include them because other profs recommended them so highly. So the first is Indigenous Rights, a guide for First Nations, Métis, and Inuit issues in Canada, and Elements of Indigenous Style, a guide to writing by and about Indigenous people. And I think I might have read Indigenous Rights when it first came out, but I'm not 100% sure, so I probably need to reread it. But the cover looks really familiar. And like the other recommendations, these two, along with Structures of Indifferences and Fighting for a Hand to Hold, are all available free online through the U Ottawa Library. And that's all for now. Between this video on patient involvement in IPE and this, I have done way too much talking this weekend. So let me know if you have any questions, and as always, I will see you all online.